Good morning and thank you for joining us. Teresa is not here today and continues to work from home. I'll report our local numbers. We now have a total of 11,057 cases, an increase of 35 cases from yesterday. 2 cases are related to outbreak, 4 are close contacts of confirmed cases, 29 cases are still being investigated. We have 2,673 cases that are active, 8,128 cases have resolved. We now have a total of 256 deaths, an increase of 1 death from yesterday. A woman in her 90s from a retirement home passed away. I want to express my condolences to the family, and my thoughts and prayers are with them in this difficult time. We have 119 cases are in the hospital system, 18 are in the ICU. There are 48 active outbreaks, 21 outbreaks in long-term care home and retirement home, 23 workplaces, 3 hospital outbreaks, and 1 community outbreak. We are seeing a day-to-day fluctuations in the case count, and I'm sure many of you are wondering if this is an error. At this point, I don't have any official notification from the labs about any planned delays in reporting, but it is possible due to the high volume, test results are prioritized in a different way, leading to day-to-day fluctuation in our daily case counts. However, I'm still cautiously optimistic on these numbers. As I mentioned last Friday, some of our indicators are starting to show an improvement, and I truly hope that we are moving in the right direction. But I want to be extremely clear. This is just a start, and we need to sustain it. We want to bring the case counts down to a level to ensure public safety, save lives, and get our local economy going. We can only achieve that if we keep the goal in our mind and work towards it. We can complain as much as we want, but this is still a global pandemic, and Windsor-Essex have been in the front and center of it. The only way to move forward is to follow the public health measures. I know it's not easy. I know everyone is frustrated. I know we all want our lives going back to a pre-pandemic timeline, but we can only get there if we follow the public health guidelines. Thank you.
We'll now take questions from the media. Today we'll start with Amy 100.
Dr. Ahmed, in regards to the cases over the weekend, obviously 87 Saturday, 270 yesterday, and then 35 today. I know you said the numbers are basically all over the place right now. Are you surprised by that, or you had a gut feeling we would see something like this?
Well, honestly, when I looked at the number, that was my first reaction. If we're missing anything, is this an error? But we did look at those numbers carefully. Went back to all the data, all the tests that was processed by the lab in those timeline. And as we know that there are some delays in the lab to process some of those specimens, right now, based on what we know, we don't have any reason to believe that there is an intentional delay for all of these test results. But even looking at, if you break it down to 3 days, and then we take an average out of all these 3 days, we can still see some improvement. So I think that's what I'm hoping, that over the time it will stabilize, even if it's day-to-day fluctuation. But some of the other indicators, what we are noticing right now, they're starting to show improvement. So I want to be optimistic. I want to see that as something that's a good news, good sign for all the public. All of us are making a huge sacrifice in trying to keep our community safe, try to save lives, and we just got to do it. We'll continue to share more and more information as it becomes available, but obviously I would take that as a good sign for us moving in the right direction.
Last week you mentioned how you're optimistic. You used the word hopeful as well. I guess with these numbers and on the decrease, do you believe the safety measures that the local health unit has put in place along with the province are making a difference here in Windsor-Essex?
Of course, absolutely. There is no doubt in my mind that these measures do help. The only thing that is critical is the public following those measures. And as long as we are following those measures, these measures work. These measures help to bring the case counts down. And there is no doubt, there shouldn't be any doubt in anyone's mind that when we are doing all this sacrifice for our community, for everyone, for ourselves, it works and it should work if all of us will continue to follow. So I want to thank everyone who are following all those recommendations, and we really want to see these numbers coming down and get our community back to where we were.
Thank you.
Any questions from CTV?
Yes, good morning. I'm just wondering, has anyone in Windsor-Essex had an adverse reaction to the Moderna vaccine?
Well, we do get all these adverse event following immunization reports all the time. We process all that information. Some of those reactions are generally expected as identified in the clinical trial, and even just from the vaccine perspective, people people get pain, sometimes mild malaise, fever. All of those things are pretty common with the vaccines, and we continue to get those. And sometimes in the worst case scenario, we get more concerning reports that is followed appropriately and are sent back to the provincial database, which in turn is sent back to the national database to look at the vaccine safety, all these adverse events at a various level, and then shared globally with the WHO as well to monitor the vaccine safety issue across the world. So there is a good system in place to track all of these adverse events and report it back to the appropriate levels.
Okay, thank you.
Any questions from CBC?
Good morning. Doctor, I was wondering if you have a sense of how many people are getting tested for COVID-19 lately, like whether those numbers have gone up or down, if you've seen any fluctuation.
Well, the numbers fluctuate every day, as we know, but last Friday I did report the overall tests that were conducted in the last week. I believe it was close to 11,000 tests a week. Back in the early pandemic days, we were looking at 2,000, and then it went up to 4,000, 6,000. So we are doing roughly 11,000 tests more recently. But again, these numbers, sometimes they fluctuate depending on the day, depending on what's happening with any type of exposures. I don't have any reason to believe at this time that number has gone down. We are aware that Windsor Regional Hospital already opened up another assessment center to get to meet the need of the community. So as I can say, day to day, it can fluctuate, but we do report that on a weekly basis, and the next cycle I would probably report on this Friday.
Thank you. I was also wondering about the update on vaccinations. Are all the homes, they're supposed to be complete in the coming days? Are any vaccinations happening today?
So vaccination continues to happen in the retirement home. We are on track to complete our retirement home with some minor challenges with the home's inability to administer the vaccines in time, but we are on track to complete that. The provincial expectation was about for the long-term care home residents, which we have already gone through the cycle and provided the first dose of vaccine to all the residents. There are some staff that are scheduled to get their vaccines who have indicated their interest in with the regional hospital clinic, and those who are at the home, they are getting their vaccines when the homes are getting the vaccines for their residents. So a combination of all those measures are happening, but it's on track, and we hope to vaccinate all the residents as much as possible to ensure that their lives are safe, and we don't see that level of outbreaks that we have seen in the past.
Thank you.
Any questions from Blackburn?
Yes, good morning. You mentioned on Friday about the lab coming online here this morning. Is that still the case? And do you think that could be contributing to the delays, possibly just moving things over to the new lab?
That's a good question, and I don't know the answer, but I can tell you that there are good systems in place to to work through shifting some of these lab specimens through the various lab network that already exists. So by default, most of our tests go to London lab, and then if London lab exceeds that capacity, it is passed on to the Public Health Ontario lab in London or to Toronto or to some other provincial lab network. Having this local lab come online obviously would change things. Their capacity is limited, so I think right now they are not at the same capacity level as with the London Health Lab or some of the other labs. So I don't know the answer, but I don't think that would be the only driving factor in seeing some of these fluctuations in the number.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. You spoke about challenges with completing vaccination in retirement homes where the home itself isn't able to administer the vaccine. Can you speak more about that? Does that mean that the homes have to wait for the health unit's public health nurses to come in and do that job?
Yeah, so we are working on all the three possible models that we can think of when looking at these long-term care home, retirement home, everyone. The first option is obviously if the home is capable of administering the vaccine, and most homes are, because it's not the first time that they're doing it. Flu vaccine and other vaccines, they do it regularly every year, so they do have that capacity. The only thing is, if the home is having an outbreak, then there are staffing issues, then their ability to administer the vaccine in the middle of an outbreak, can they do that or not? So that's number one. So option number one, the home taking it on with their staffing to do it. And then in some homes, we see a blended model where the homes say, yeah, we can do it, but we need some support. And then how our team is supplementing those additional support that they need. And then the third option is where the homes are basically saying that, no, we don't even have the capacity to do it. And then the health unit team is supporting them. So again, depending on the home, we do look at all the options, and some of the homes, retirement home in particular, they don't necessarily have that level of nursing staff they need to get all these vaccines done in their residence. So that's why they are different than the long-term care home in terms of their ability to administer those vaccines, and that's what we are dealing with right now, the capacity issue, and we are supporting them as quickly as possible. We have a number of teams that are sometimes going into different homes to support them.
And Teresa last week optimistically said that it would be done maybe around Tuesday. Do you think that's realistic, or do you think it will be done by the end of this week?
Well, I think our plan was to finish them by Monday or Tuesday, but at this time, I think because of some homes unable to do that in a timely manner, it can be pushed up to, I believe, Thursday. And we're hopeful that if the support system that they are looking at, if they can get in place, we can finish it sooner than later. But even and again, the reason that I'm still reluctant to say that by Thursday it will be complete is because there may be some other issues that may prevent them from getting it done in the timely manner. All I can say is not a delay from our end to say that we are unable to provide that support. It's just having all of those systems in place to get it done.
And separately, about the lab that's supposed to be opening today, do you know where the best place for us to direct questions about that lab would be? Is there a different organization, a body that will know everything that's going on there?
Well, I think the lab themselves can provide you with that information. If you're talking about the media in particular, right, Taylor?
Yes.
Yeah, I think the lab would be in a better position to do that. Other than that, I would say Ontario Health, they are the one who's coordinating all these lab network in the province. They may be able to provide you with that information.
Okay, thank you.
Any further questions from AMA 100?
No, thank you.
CTV?
No, thank you.
CBC?
No, thanks.
Blackburn?
No, thank you.
Windsor Star?
No, thank you.
Thank you, everyone. Have a good day.